Good morning, everybody. And my name is Dr. Ranga Krishna. We have a group of practices in New York City. Our website is Medical Clinics of NYC. We specialize in neurological diseases, pain management, and neuromuscular diseases. I would like to sort of use this opportunity to reintroduce our YouTube educational videos on commonly diagnosed neurological and neuromuscular diseases. The first topic that we're going to do today is a topic of common prevalence and very frequent incidence. The topic is called headaches. Headaches is a generic term for any pain that encompasses the head. The headaches are sometimes confused with migraines. There is a slight difference, but I will come to that later in this topic. With regards to the headaches, the most common types of headaches are the tension headaches. These are because of people focusing on a computer for a long periods of time, or have a problem with their glasses and they're not perfectly correct, so they need corrective glasses to improve their visual acuity. Also, headaches are due to people grinding their teeth or chewing excessive amounts of gum, or experiencing episodes where they have pain on the sides of the head and it sort of encompasses the front of the head. And that usually is a tension headache because the muscles around the scalp, which are called the temporalis muscles, they're being used or overused, and thus resulting in headaches. These types of headaches are not usually related with some premonitions. The premonitions that are common with migraines are not in tension headaches. What is a premonition? A premonition is where you feel like the headache is going to come on, or you have a visual symptom that the headache is going to come on, or you feel nauseous after the headache comes on. That doesn't usually occur with tension headaches. Patients usually come to our office because they've been having these tension headaches for weeks or months, and they get worried whether or not there's something more serious going on. Tension headaches are very common. Millions of people are diagnosed with it on an annualized basis. The reason that's happening more and more is because of the type of work people are doing. Most people are now working on computers for hours on end, and they seem to be focusing on one computer or two computers. That ultimately results in them having increased amounts of tension in the sides of the head, and that results in tension headaches. Tension headaches are usually evaluated to make sure that nothing more serious is underlying. The evaluation usually includes an ultrasound of the blood vessels that go from the neck to the brain and from the outside of the skull into the inside of the brain. These are called the carotid and transcranial Doppler studies. It's a common evaluation that is done. It is done in the office. It's to make sure that there's no blockage of the blood vessels or anything that's very small in the blood vessels, or there's a problem with one blood vessel sending enough blood to the brain. If there is, then that can be easily treated with a blood thinner. If it's something more serious where there's a big blockage because of a cholesterol plaque, then that may end up requiring surgical intervention. That usually ends up in surgical intervention when the plaque is more than 75% narrow. But generally speaking, that doesn't occur in tension headaches because it's usually a condition that occurs in younger people who are otherwise healthy, but they tend to sit in one position, slouch over, and look at a screen for 7-8 hours a day, and that causes tightness of the muscles around the scalp that results in headaches that travel to the front. Additionally, another type of headache that commonly occurs is migraine headaches. Migraine headaches are of several types. Some of the hallmarks of a migraine headache can be, it doesn't have to be, but can be, where you get a premonition. So you may be working, doing your usual daily routine, and all of a sudden you feel that you're getting nauseous, and you're finding that you're getting bright lights in your visual field. These are called scintillating scotomas, and you're feeling like that something is going to happen. You have a sense of doom, and that usually is followed by a migraine headache. Is a headache which occurs throughout the head, whereas a tension headache usually occurs on the sides of the head and the front of the head. Migraines usually occur throughout the head, front to back, and on a normal pain scale, 0 to 10, 0 being perfect, 10 being horrible, migraine headaches at their peak usually are around the 8, 9, or 10. Tension headaches on the other side, as comparison, are at a level of 4 to 6. So tension headaches are much milder than migraine headaches. Migraine headaches, as I mentioned earlier, are of several types. They can be migraine headaches with an aura, that's called a premonition, where you feel like something is going to happen, and a half an hour later it happens. Then there's migraine headaches without an aura, where you feel like the migraine headache all of a sudden comes on and occurs throughout the head, and your patients usually tend to take an anti-inflammatory medication or Tylenol, or go to a dark room and lock themselves in that dark room for about 10 minutes, and that seems to dissipate the headaches over a period of 10 to 20 minutes. There is another type of migraine headache which is called cluster headaches. Cluster headaches are headaches that occur in clusters. What does that mean? That means it occurs once every month or once every 2 months, but in a particular period of time. It occurs for 3 to 5 days at a time, and it is very painful, and it usually occurs on one side of the head rather than the other side of the head. These cluster headaches can be cluster headaches of hemicranial, that means half of the head, or entire head, which is cranial. When those headaches occur, they last for 4 days or 5 days, and if you take treatment, you can reduce the intensity of the headaches, and at the end of 5 days it goes away, but it keeps coming back every couple of months. It's predictable, almost like clockwork. The other common type of headaches that we see is sinus headaches. Most of us have nasal sinuses that move air in and all the way to our lungs, and the lungs send the air into our bloodstream and goes to our brain. If you block one of the sinuses around your nose, just because of weather change, humidity change, or you've been in an airplane, that can happen very easily. Or you get a cough or a cold, and you get a flu, and your sinuses get blocked. You tend to get these headaches that are primarily in the front of the head, as I'm pointing it out to you. They stay in the front of the head. Sometimes they go to the middle of the head, and they can stop there. They never usually go to the back of the head. The sinus headaches usually are associated with nasal stuffiness and a pain over the sinuses. We have 2 big sinuses on either side of the nasal cavity, so if you press on those, you'll find that one of the sinuses is very painful. You also have sinuses behind the eyes. If you press on the notch just behind the eyes a little bit, you may find that's also painful. Sinus headaches are a important issue, because sometimes it can be due to an underlying infection in the sinus cavity. The sinus headaches, when they do occur, they can cause nasal stuffiness, difficulty in sleeping, difficulty in breathing, and it's important to get that evaluated to make sure that there's no infection in the underlying nasal cavity. If there is, then it has to be treated with antibiotics, and it's very important to discuss that with your primary care physician. With regards to the other type of headaches, called the hormonally related headaches, this is very common in young women who have regular menstrual cycles. It can be also found in women who have ovarian cysts, which is a condition that fluctuates hormonal levels in the body, and that can cause hormonally induced headaches. And many young women tend to have headaches that occur 1 to 2 days before their menstrual cycle and throughout their menstrual cycle, and stop about 2 days after their menstrual cycle. Those types of headaches are related to the hormonal fluctuations in women. It is predominantly in women, almost 95% of the time it's in women. But when it does occur and it fluctuates around the hormonal cycles, it's relatively easy to treat. The advantage is that it's treated with medications around your hormonal cycles, and it started about 2 to 3 days before and stops about 2 to 3 days afterwards. Therefore, you can prevent it from getting any further. The other types of headaches that are commonly seen are exertional headaches. So if you go working out on a bike or a treadmill, and you do excessive amounts of workout, you can trigger a headache. That also can be seen in patients who go to a dry sauna and get dehydrated but don't rehydrate themselves. Those kinds of headaches are usually due to relative dehydration to your baseline. So those are easily treated with excessive hydration before you start the workout and some hydration after you start the workout. So that if you're planning on doing a significant amount of workout on the gym treadmill floor and then go to a sauna afterwards, I suggest drinking about 1 to 2 liters before of water and then another liter afterwards, so you don't get dehydrated and you don't trigger a exertional headache. Those exertional headaches are very similar to tension headaches. They occur along the side of the heads and in the front of the head, and it's usually treated the same way with some medications that are anti-inflammatory or medications like Tylenol that tend to help get rid of it, but hydration is the best. The important take-home points that I wanted to bring out today is that the difference between general headaches, that is tension headaches, exertional headaches, and headaches due to posture, are all related to pain around the sides of the head, front of the head, and they're usually not an emergency, but they require modification of your behavior. The modification of your behavior means that if you're sitting on a computer for 8 hours a day, try to take breaks where you don't look at anything for about 15 minutes every 1 to 2 hours. That reduces the risk of tension headaches. The other thing is, if you're planning on doing any exertional activity, I would suggest you drink a lot of fluids like plain water before you do it, and then after you do it, rehydrate yourself with some water also. With regards to migraine headaches, they are of several types, as I mentioned earlier. The treatment is usually based on the frequency of the headaches. The frequency of the headaches are very important. If the headaches are occurring weekly and they're incapacitating you as a patient when they occur, and they're becoming intrusive into your work activities and activities of daily living, then it's appropriate to treat those types of headaches or migraine headaches. If it is a migraine headache that is occurring relatively frequent every week or every few days, there are 2 types of medications that we usually try to use to treat. One is a medication taken every day at night to prevent the headaches from occurring, and a medication to treat in case the headaches break through. So the treatments are divided into 2: prevention medications and abortive care, abortive when it occurs. The success rate of these newer medications, which basically work on the chemicals of the brain, are excellent in today's age of newer medications. Their success rates are, once you get the right cocktail of medications, the frequency and intensity of the headaches can be reduced by 90%, which should improve your quality of life and your ability to perform your work activities. With regards to cluster headaches, it's primarily treated just before you get the headache. So patients usually know that on the 3rd week of every other month, they tend to get a cluster of headaches that lasts 5 days, for example. If that happens 1 or 2 days before you start a medication that is usually an anti-inflammatory medication, and then go on till the end of that week, at least a day or 2 after, to prevent the cluster headache from occurring. The chances of it occurring on top of those medications is slim to none, because the treatment usually is very effective. There are many treatments for those. Those treatments range from anti-inflammatory medications to chemicals such as lithium and even steroids. Those can all be discussed either by your primary care physician, or if you come to one of our offices, I'm sure our physicians will be happy to discuss that with you. What is a normal evaluation that we as a specialist do for a patient that comes in with headaches, migraine headaches, cluster headaches, or menstrually induced headaches or exertional headaches? The normal evaluation is that if you're a new patient with these types of symptoms, and if your exam is relatively normal but your headaches are fairly incapacitating, we usually make sure that there's no blockage of the blood vessels that are going to the brain. That is with an ultrasound of the neck and head. We also suggest an MRI of the brain just to make sure that there's no aneurysm in the brain that is being missed out, because aneurysms can occur in 5 to 7% of the general population, and if it's found early, it can be life-saving. The other evaluation is we sometimes, depending on what we find, do an electroencephalogram. It's a brainwave activity test of the head. It's like an EKG of the heart. The reason we do that is because it allows us to make sure on those unique cases that the headaches are not being triggered by an underlying seizure disorder. It's rare, but when it does happen, it's treated very easily. So that's the basic treatment. The evaluation of an MRI of the brain is very important because that helps us make sure that no other extraneous factors are causing the problems, such as the aneurysm, brain tumors, cysts, or bleeding in the brain that has occurred without your knowledge. These are all things that can occur and may be important to find early, because once identified, it basically allows us to figure out a cure. With regards to when should you go out and seek medical care? Usually, if the headaches are present sequentially, every few days, every few weeks, every few months, and it's bothering you to the point where you're impacting your activities of daily living, activities of your work activities, then it's appropriate to go out and seek specialty care. Specialty care is usually a neurological consultation and a workup of what I mentioned earlier. That includes an ultrasound of the head, an MRI of the brain, and some medications would also be initiated to prevent these headaches from occurring until the time you're followed up with all your results. At that time, you would be stabilized on a group of medications, one to prevent the headaches and one to treat it in case it squeaks through. The success rates, once again, the success rates of preventive treatments are usually very high once you get the right agent. We have many medications out there now, and once you get the right agent, the success rates are 80-90% or better, so that instead of having 2 to 3 headaches a week, you may have 1 headache every 2 weeks, which is not significant in intensity because you're already on a prevention drug, and you would be taking an abortive agent on top of it in the morning when those headaches do occur, so that you can reduce that intensity also. That's the end of our discussion today on headaches, the various types of headaches, migraines, and some of the types of migraine headaches, and how a workup is done for a patient with headaches and migraines that when you see a specialist. If you have any questions, please feel free to put it in our comment section, and we will be more than happy to answer those for you. Thank you very much.